If you're interested in becoming a doctor or PA, or even just looking for a soft entry into the medical field to see if you like it, I'm going to be breaking down 5 different job opportunities that can get you patient experience and show you what it's like to work in a clinical setting. Let's get right into it. Becoming a medical assistant is an extremely popular intro to healthcare. Even some nurses start off as medical assistants. A medical assistant is trained in a wide variety of skills, which allows them to assist physicians and nurses in many different areas of healthcare. The scope of a medical assistant is limited to what they're trained on, but also what the facility or the physician that they're working under says they can or cannot do. But the typical scope of a medical assistant includes, but isn't limited to, taking vitals, obtaining a patient history, taking EKGs, drawing blood, and even administering some medications and vaccines. Medical assistants have to go through a continued education course to become a medical assistant. Now, the price range for this course is typically $1,500 to $2,000. This course typically takes about 4 to 6 months to complete, along with a certification test at the end. But the experience that becoming a medical assistant will bring you is invaluable. And the pay average for becoming a medical assistant is typically around $21. So you're being adequately paid for your time. The only requirements for enrolling in an MA program is being over the age of 17 and having your high school degree or a GED equivalent. Next up is phlebotomy. This is still a pretty popular option amongst people looking to gain experience in the medical field, but I feel like it's completely underrated. In the course, phlebotomists are trained to draw blood, but depending on the facility that you work at, your employer may also cross-train you on taking vitals, running the lab samples, and even how to start IVs. The reason that I think this is great clinical experience for anyone is most people hate being stuck with a needle. So this allows you to try and make what is typically an unpleasant experience for somebody into something manageable. And in healthcare, there's a lot of unpleasant experiences. So if you're able to empathize with somebody and keep them calm in a nervous situation, this is going to be a great skill to have later in your career. Another added benefit of becoming a phlebotomist is that the course is much shorter than that of an MA. A typical phlebotomy course usually takes about 2 to 3 months to complete. Not only is it shorter to complete, but it's also a much cheaper continued education course than MA. Compared to the typical $2,000 of an MA course, a typical phlebotomy course will usually run you about $310. Now, the average pay rate for a phlebotomist is usually about $18.53, but the amount of time and money you save might be worth it to you. For a phlebotomy course, you also have to be over the age of 18 and have a high school degree or a GED equivalent. So physical therapy technician might be a job that you've never heard of before. Now, not to be confused with a physical therapy assistant. These are 2 completely different jobs. Being a physical therapy technician does not require any certifications. It's all on-the-job training. There are programs to get a physical therapy technician certificate, but overall, it's not required at most jobs. Physical therapy technicians work in physical therapy clinics, but they can also find jobs in rehab centers. So another difference between this job and the past 2 jobs is that this one does not require you to work with any blood. If it makes you squeamish or nauseous or you think it's disgusting, this is the job for you. So you might be asking, what do physical therapy technicians even do? The typical roles of a physical therapy technician usually include helping patients with therapeutic exercises, helping manage patient records, assisting with the upkeep of the facility and equipment, and also encouraging and supporting patients in rehab. The pay range for physical therapy technicians is usually somewhere between $12 and $16 an hour. Usually they're pretty good about working around your school schedule too. Now, like I said at the beginning, this is a job that not many people know about. Now, this is typically a job for people who are interested in becoming a physical therapist, but I think this could be a great opportunity for pre-meds, especially ones that are interested in sports medicine or orthopedics. Alongside the part of no blood, another benefit of this job is that you get to see long-term progress in the people that you're working with. And some of the other jobs previously mentioned and the ones that are going to be mentioned, you don't always get to see the final results of your patient. But in physical therapy, people are coming back on a regular basis, so you get to see them working, improving, and getting better. You also get to build relationships with your patients, which might not always be a possibility in some of these other jobs. And like I said, there's no certifications for this job. All they want you to have is, you guessed it, either your high school degree or your GED. Emergency medical technicians, also known as the ambulance drivers, are healthcare professionals that can be found in the ER, on the ambulance, or even working some contract jobs for special events. They are trained in BLS, basic life support interventions for emergency situations. The training this requires is your first semester of paramedic school. A paramedic is trained in pre-hospital advanced life support interventions. To be a paramedic, you have to have your EMT and then 3 more semesters. But today we're only talking about getting your EMT. Working on the ambulance or in an ER setting can be a very fast-paced job. You can be faced with some very tense situations, but it also requires you to learn to be quick on your feet and to think autonomously. When you're in an ambulance, there's not always a doctor directly to tell you exactly what to do for every situation. As an EMT, your paramedic will primarily be the one making decisions when it comes to your patient's care. However, there are some ambulance services that do not always have a paramedic on board, so it will be up to you and your partner to make the best decision possible for your patient. Now let's talk about some of the roles and responsibilities of an EMT. Working on an ambulance, you will be working with your partner, and whether it's with another EMT basic or a paramedic, one of your responsibilities is assisting your partner. Even if you're not working on the ambulance and you're working in an emergency room setting, it's going to be essential that you learn to work with your fellow nurses and ER technicians. You will also be responsible for driving the ambulance, getting the patient to the correct facility and in the best condition possible, keeping inventory of the ambulance, and also being a patient advocate out in the field. Compared to the scope of a paramedic, the scope of an EMT is usually pretty narrow. Your scope will typically include obtaining vitals and the administration of some basic medications. This is why people typically know EMTs as the ambulance drivers. Since the paramedic has the wider scope and can perform more interventions, the EMT is typically the one driving and the paramedic is usually in the back taking care of the patient. Now, like I said, to become an EMT, it requires your first semester of paramedic school. This is 3 months. Now, this class is usually in the range from $1,500 to $2,000, alongside with a test, your national registry. Your national registry is what allows you to practice emergency medicine in any state. So this is essential to have. Also, EMTs on average make $17 an hour. I think that becoming an EMT might be the best clinical experience out there. You're learning how to handle virtually any situation that comes your way. This experience will groom you out to be a great physician. You'll learn how to interact with patients, think for yourself, and work with the team. So you will have a leg up on your peers in these areas. Now, to become an EMT, you do have to have your high school degree, over 18 years of age, and pass a background check. Now, last but not least is becoming a scribe. Now, I'm sure as a pre-med, this is a job that's been recommended to you many times, but what actually does a scribe do? A scribe works side by side in the hospital with a doctor. Their main goal is to help their doctors with their patient documentation, and they also help keep the doctors on track. This job does not require any certifications, however, they typically require you to be on some pre-health track. Some scribe positions require you to have taken a medical terminology course, but it's not always required. But for the most part, becoming a scribe is on-the-job training. Now for some informal requirements of becoming a scribe. You have to be a good listener, a quick typer, and be ready to walk a lot. Depending on the department that you're working in and the kind of day that you're having, you can end up seeing a lot of patients. Having to see all those patients, physicians are not going to be wanting to repeat themselves all day. So you're going to have to be able to hear the physician the first time and type it out quickly, along with the fact of keeping up with the physician as they visit every single patient's room. Now, the pay average for becoming a scribe is $15 an hour, but you're getting repaid with amazing experience. First of all, this is a great opportunity to build relationships with the doctors. You're working side by side with them for 8, 9, and even up to 12 hours, so you get to know them personally. This can be helpful because when you apply to med school, you're going to need a few letters of recommendation. One of those letters of recommendation being from a physician. So be helpful, be respectful, and be nice, and hopefully they'll write one of these for you. Another great opportunity of being a scribe is that working side by side with a doctor all day, you get an inside look at what the day-to-day life of a doctor actually looks like. And depending on how close you are with a doctor, You can even find out how being a doctor affects their at-home life. But overall, one of the best things about being a scribe are the things that you learn. You get to be right inside the room as the doctor evaluates their patients. Not only that, but you get to hear their diagnosis, thought process, and their treatment plans, which are all things that are going to stick with you when you become a doctor yourself. You also get to learn what really good doctors look like and what really bad doctors look like. Now, here are the issues I have with scribing. First of all, since you don't have any training, you don't get any hands-on experience. This leads right into my second issue with scribing, is that not all schools count this as patient care experience. To me, this is a problem because this is something that med schools want to see. So depending on the school, the primary reason of having the job might not even be beneficial to you. Also, depending on the school, this may not replace shadowing hours, which is another huge benefit of having the job. But overall, if you don't need patient care experience or shadowing hours, this is a great job for you. Like I said in the beginning, there's no certifications necessary to become a scribe. Just make sure you go to high school or get a GED. And guys, that is 5 jobs that will get you clinical experience. If you liked the video, leave a comment, like and subscribe, and I'll see you in the next video.